expressed by the guest and presenters of Radio Al Ansar are not necessarily the views and opinions of Radio Al Ansar and the Al Ansar Foundation.
Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to the Medical Files, brought to you by the Islamic Medical Association of South Africa, IMA, who recently held their 43rd annual convention, which was a huge success, alhamdulillah. So this is Medical Files, your weekly health segment where we take a deep dive into topics that matter to your health and to your well-being. We're broadcasting live from our Durban studios tonight at Radio Al Ansar, and we will also welcome the listeners of Radio Islam, Channel Islam, IFM, Voice of the Cape, Sirius FM, and Radio 786. I'm your host for tonight's topic of discussion. My name is Dr. Zakaria Ahmed Ismail. I'm a medical officer based in Durban. So whether you are tuning in from your car, your home, you're in the right place to learn something that could very well save a life. And tonight we focus on a hidden danger that many people are unaware that they may be suffering from, and that is apnea, specifically sleep apnea. It may sound harmless, but the consequences can be quite devastating if left untreated. And joining us for our discussion is our esteemed guest, Dr. MOHAMMED THANDAR, who is an ear, nose and throat specialist surgeon with extensive experience in treating sleep apnea. And together he's going to help us unpack what apnea is, why it happens, how to detect it, and most importantly, what to do about it.
Assalamu alaikum, Zakaria. Jazakallah for having me. It's a pleasure to be back here at Al Ansar.
Alhamdulillah. Pleasure having you as well. And as always, this is your show too. If you have any questions for us, you can send in your WhatsApp messages on 060-904-1056. That's 060-904-1056. And we'll take your questions later on in the show. So thank you for joining us, Dr. Thandar. Our focus tonight, sleep apnea, a condition that quietly affects millions but is often brushed off as just snoring or being tired, when in reality it can be life-threatening. It can disrupt your sleep, it can disrupt your oxygen levels, it can disrupt your focus, and eventually your entire health, and can even lead to serious accidents, heart problems, and more. Yet many people don't even know that they have it. So we're going to talk about exactly what sleep apnea is, who's at risk, how to spot it, and what treatments are available. So, excuse me. This isn't just a topic for the elderly or the overweight. It can affect children, it can affect pregnant women, and possibly even yourself at home. So, Dr. Thandar, let's start from the basics. What exactly is apnea and sleep apnea?
Yeah, shukran. You mentioned quite a few interesting facts there, and it's certainly a very under-recognized condition, underappreciated, not just amongst the public, but even amongst in the medical profession. A lot of people just assume that snoring itself is just an irritation, and usually harmless to the spouse. But before we discuss apnea, what's important to understand is that we're dealing with a spectrum of disease here, called sleep disordered breathing.
Okay.
And snoring itself is at one end of the spectrum. We call that primary snoring, where there's just noisy breathing when you are asleep. And that's usually related to an obstruction to the flow of air while breathing asleep. So that's primary snoring. Now, at the other end of the spectrum is what we're discussing today, called obstructive sleep apnea. And that's the more severe form of sleep distorted breathing that can have many consequences, which we will discuss. So, and then in between, there's a condition called upper airways resistance syndrome. So it's sort of not as severe as sleep apnea, but not as mild as just primary snoring. So to come back to your question of what is apnea and sleep apnea, apnea essentially means a lack of flow of air. So when you're breathing asleep, there's obstruction to the flow of air, and we'll discuss what causes that obstruction. But that is termed as apnea if there's complete obstruction, or hypopnea if there's partial obstruction. And this apnea itself occurs during certain phases of sleep, and it's usually in the phase called REM sleep. Sleep we look at near REM and non-REM sleep. But it's not just that the fact that there's an obstruction, it's due to a lack of effort to breathe. There's effort by the person to breathe. So you're trying to breathe, but the air is just not moving.
It's not going in.
And that would bring us to, what is causing this apnea. But, before we look at that, as you mentioned, it's very common in the population. We don't have good statistics here in South Africa, but in the literature, you're looking at about 3 to 4% of people have some degree of apnea. But the fact that it is so under-recognized, under-reported, we are missing a lot of patients
So
with
the
sleep
number
apnea.
might actually be a lot larger.
So it's a lot larger than that. And as you mentioned, it can happen at any age, and we'll talk about the different age groups. But also in the obese or overweight population, it is a lot more prevalent, and there's a lot more risk associated with it. So if you look at sleep apnea in children, again, sorry, before we go to that, let's just talk about, how do these patients present?
So some of
and
the
this
common
may be in
symptoms,
children and in adults.
Okay.
So the first thing, there's a syndrome called obstructive sleep apnea syndrome. And the syndrome is the presence of significant snoring, usually, together with what we call apneic episodes, so witnessed apneic episodes. And witnessed usually by your sleeping partner or the parent, who actually witnesses that during your sleep, you actually stop breathing for either a few seconds, sometimes even a couple of minutes, although there's efforts to breathe. So you struggle to breathe in your sleep. Okay? And then the other part of the syndrome is its effect on you in the day. So it's daytime sleepiness. So obstructive sleep apnea syndrome is the presence of snoring together with apneic episodes and together with tiredness during the day. Okay. So if you have these symptoms, if you're a snorer, if people tell you you're struggling to breathe in your sleep, you stop breathing, you hold your breath in your sleep, and you're feeling tired during the day, then it's likely that you have obstructive sleep apnea syndrome.
Those are some of the warning symptoms to look out for.
Exactly. Okay.
So you mentioned now what is obstructive sleep apnea. What happens if there's still apnea, but there's no actual obstruction? Is there something that's related to the brain, maybe that causes the muscles to stop breathing?
Yes, so that's called central sleep apnea. So that's a different form of sleep apnea. Okay, so we're discussing obstructive sleep apnea, which is by far much more common than central sleep apnea. And that's due to causes within the brain, with poor stimulation of your muscles of breathing. Okay, fortunately, that's very rare, difficult to treat, and can be life-threatening. But it's very uncommon. Okay. Usually, maybe the neurologists see more of that.
Mm.
I must say, in my experience, I've only seen 1 or 2 patients with
Okay.
that. Yeah.
Does it look the same as obstructive sleep apnea in terms of its symptoms, or is it something entirely
Well,
different?
the main difference is that with obstructive sleep apnea, you're having the apnea, but you are still trying to breathe.
Okay.
But because of the blockage, because of the obstruction, there's no flow of air.
Okay.
Whereas with central sleep apnea, there's no stimulation to your muscles of breathing.
Mm.
So there's no effort to breathe, and there's just the apnea and its consequences.
Mm. Quite a scary situation. How would you say that this condition affects daily life of a person who may be suffering from obstructive sleep apnea?
So it affects obviously, firstly and primarily, it affects their sleep. Okay. So there's going to be snoring, there's apneic episodes, and this causes difficulty breathing during your sleep. It causes a restless sleep. There's your patients wake up frequently, or they toss and they turn. During these apneic episodes, what's actually happening at a physiological level is that your oxygen levels are falling. And in some cases, in the most severe cases, your carbon dioxide levels are increasing. And this creates a whole lot of metabolic changes that are going on within the body. But the way it presents is with restless sleep, waking up at night, sometimes with a gasping or a choking sensation, passing urine frequently during sleep, and then waking up feeling tired. Okay. And although you may be having quantity of sleep, you may sleep 7 hours, 8 hours, 9 hours, but the quality of sleep is not there.
Okay.
And so you're not getting restful sleep. So you wake up feeling tired, and then this affects you during the day. So some patients will be tired the entire day. You have episodes of falling asleep easily, okay, especially when you're not concentrating on anything. So like watching TV, listening to sitting in a meeting, and some people, in the worst case scenarios, people have it even while driving. And obviously you can understand what consequences that may have. But irritability, poor concentration, mood swings, headaches, okay, these are all the sequelae or the symptoms of poor quality sleep.
Right.
And it can even lead to depression and anxiety. So it has far-reaching consequences, and these are sort of maybe vague symptoms, and therefore the underlying cause is often under-recognized and underappreciated. So it's important to have it at the back of the mind. Ask about sleep, ask about quality of sleep, ask about snoring, ask about if the sleeping partner witnesses difficulty sleeping, difficulties breathing while you're sleeping, apneic episodes, and with parents as well. Okay, very important is to look at children with sleep apnea. Okay, and the most common cause of sleep apnea in children is large obstruction from large adenoids and large tonsils. Okay, and this is,
so that actually blocks the airflow coming in.
It blocks the airway. So the adenoids, which are like tonsil tissue, but they're at the back of the nose, can obstruct the nasal airflow, and the tonsils obstruct the airflow through the mouth. And this leads to snoring and sleep apnea. And in children, it presents with poor daytime behavior, concentration, poor attention span, which can lead to behavioral issues, unable, not concentrating in class, not listening to the teacher. So we see a lot of patients that are referred from pediatricians, neurodevelopmental pediatricians with ADHD, attention deficit disorder, behavioral disorders, to assess them for sleep apnea, because that is has such a huge impact on their daytime behavior
Behaviors.
and school performance.
So snoring, does that always mean that if a person is snoring, does it always mean they have apnea? Or can you have snoring without apnea?
Yeah, so as I said, it's a spectrum of disease. You can have primary snoring, where you have this noisy breathing while sleeping without any apnea. Okay. And that is, again, it's more an irritation, but it doesn't have any significant consequences. Okay. But we can, in the more severe form, you can have a condition called upper airways resistance syndrome, and then obstructive sleep apnea.
Okay, so it forms part of that spectrum.
It's a spectrum, yes,
Okay.
yeah. And there's ways to assess it, clinically, by history, and by testing, we can then distinguish, whether it's just primary snoring or whether it's sleep apnea,
Or something else.
and then advise treatment accordingly.
Well, let's talk about sleep apnea and its impact on other organ systems. So, does sleep apnea impact blood pressure or cardiovascular health in any way?
Yes, so obstructive sleep apnea most certainly may have that consequence and sequelae of, and the reasons that this develops, okay, is that, as mentioned earlier, during these apneic episodes, there are metabolic changes, which primarily result due to the lack of oxygen.
Right.
So, most of us, our oxygen levels are sitting at 98, 99%. Sometimes when we're sleeping, they go down to 94, 95%. But these patients with sleep apnea can drop their oxygen levels to the 60%. And that may persist for 2-3 minutes, okay, in the severe form. Now, when your oxygen level is sitting in the 60s and 70s, it's going to trigger, a response by the body, a sympathetic, we call it a sympathetic response, where it kicks into effect the release of hormones like adrenaline, noradrenaline, the catecholamines response. Yes, because now your body is now scared. Your oxygen levels now right down, so it has to do something now to wake you up. That's why these patients, when their oxygen levels fall, eventually it stimulates, the body is stimulated to wake up. So you wake up with a gasp or a choke. And that's part of the syndrome. Okay, it's that wakefulness. And this is happening repeatedly throughout the night, throughout the sleep. And so you can see what type of quality of sleep this is. You get into a deep sleep, your oxygen level falls when you're apneic, it stimulates these hormones, you wake up, and then it happens again and again and again.
Multiple
so
times
you can
throughout the
have
night.
a long period of sleep, but you're not getting rest.
And that's what leads to that
And
restlessness.
that's what leads to the
poor
tiredness,
sleep.
restlessness, concentration issues, poor attention, especially with children. Yeah.
Okay, Dr. Thandar, what would you say are some misconceptions that people have about obstructive sleep apnea? Some common misconceptions that you see in your practice?
Yeah, well, again, most people just pass it off as an irritation. They don't recognize its impact on the quality of sleep and the quality of a life during the day. They don't recognize that they may be having the severe form of the spectrum of disease called sleep apnea and think it's just snoring. And they pass it off as an irritation. They pass it off as, it's troubling the wife or the husband. And it's not really like their problem, Yes, yeah.
Okay.
So if people, firstly need to distinguish between, is it just snoring or is it more than that? And that's by asking the people around you, what happens when I sleep? Do I have these episodes where I seem to hold my breath? Must remember that these episodes, these apneic episodes, okay, they do occur physiologically. That means it can happen in all of us. It's not always abnormal, but it's the number of events that's happening per hour. That's how we categorize sleep apnea as mild, moderate, or severe, is by the number of events per hour.
per hour for
So
that
if
night.
it's happening like less than five episodes per hour, that falls within the normal category.
Hmm.
So, but if it's more than 5 episodes per hour, that's when this is now diagnosed as sleep apnea.
Obstructive sleep apnea.
Yeah.
Okay, so how would you say then is sleep apnea diagnosed? What's one of the best tests that you can do?
It's so we diagnose it on, as we diagnose all conditions, okay, based on the history, how the patient's presenting, talking to the patient, understanding, asking specific questions, and then we examine the patient, okay, and then obviously then we do certain tests, okay. On the history, we want to know most of what we discussed, but the key is that, is there significant snoring? Are there witnessed episodes by a parent or a sleeping partner of apnea? And is the patient tired during the day? And does he have all these other episodes? So when we suspect that this patient now has sleep apnea, then we're going to examine to see what may be causing this obstruction.
Right.
Okay. And once we're done with the examination, then we progress on to certain investigations.
Okay. Is there any role for sleep studies? Let's say someone who regularly sleeps without, sleeps alone. Let's put it that way. How do they know if they're snoring?
So let's just talk about the examination, what we're looking for. What causes this obstruction? Okay, before we discuss the tests that we would do. Okay, obstruction in sleep apnea and snoring may be classified into two groups. Okay, one is when there's physical structural problems. Okay. Blockages.
Right.
For example, these blockages may occur at different sites. Okay. The sites that we commonly look at are the nose, the back of the nose, okay, what we call the nasopharynx, the palate area, and the tongue and the back of the tongue area, okay, which is also the tonsil area. Okay, so these are the sites where anatomical or structural problems may occur that may lead to blockages and sleep apnea.
Okay,
and I'll give you some examples. Okay, in the nose itself, a severely deviated septum, large swollen turbinates which are the lining of your nose, and these can occur from like hay fever type of conditions. At the back of the nose, you can get commonly large adenoids in children. Okay, and then less commonly you could have tumors and things in adults, but those are rare. Okay, in the nose you can also have like nasal polyps that cause obstruction. By far the most common obstruction is at the level of the palate and the back of the tongue. Okay, that leads to sleep apnea in adults. Okay, children is easy. It's usually big adenoids at the back of the nose or big tonsils. Okay, adults is a whole different ball game. Very different and more difficult to manage, and different causes. So in adults, you're usually looking at blockages at the level of the palate. You can have a bulky palate, a long palate that narrows the airway. You can have large tonsils in adults, but it's often a large tongue or the back of the tongue that's a problem. Okay, and what happens as well? So the other part of obstruction is not anatomical, but is physiological. Physiological means that during phases of sleep, and we spoke about that this usually occurs in your REM sleep, rapid eye movement sleep, your muscles lose tone. So even the muscles of the throat, the pharynx, that keep the airway open, lose tone. And when that happens, this tends to collapse. And usually collapses on itself, which creates the obstruction. So usually it's a combination of anatomical problems and the physiological problems. What happens when you got a narrow airway from anatomical problems is that air is now flowing through a very narrow passage.
Right.
Now, when that happens, it creates a negative pressure. It sucks things in.
Okay.
Now, imagine if you've got a tube.
Almost like a vacuum.
Like
right?
that's now like a vacuum. And the walls of this tube now become very soft and floppy. The hypotonia when we're sleeping. It's just going to suck the tube in closed. And no air can flow through that tube. Okay, so that's what's happening when you're sleeping. So therefore, we look at anatomical problems that may need treatment. And then we look at the physiological side and ways to treat that.
Right.
Then we come to, so once we examine the patient, we got a good idea of where the blockages are.
Okay.
We look at the patient as a whole as well. Okay, you got to look at being overweight.
Right.
You got to look at other conditions that may contribute to sleep apnea, like underactive thyroid or hypothyroidism.
Okay. Yeah.
And then while you're examining as well, you also got to look at, are there any sequelae of sleep apnea already? Does that patient have heart disease? Is he diabetic? Is he or she have hypertension? Okay, these are all the sequelae.
Has it already complicated?
Yes, has it already complicated? Okay. With regards to weight, if your body weight increases by 10%, your risk of sleep apnea goes up 6 times. Okay. So that's a 600% risk
increase.
By a 10% increase in body weight. So if you're 70 kgs and you pick up weight to 77 kgs, which may not seem like a lot, your risk of sleep apnea goes up 600%. And the reverse is also true. If you lose 10% of your body weight, you can reverse sleep apnea.
That risk as well.
Okay. Not easy though to lose 10% of your body weight. And that's why it's often not a successful strategy. But let's come on to the investigations. So we've done a history, we've examined the patient, we suspect this patient has sleep apnea. Now you want to look at how you want to confirm your diagnosis, and looking towards management. And the management, it also depends on how severe the sleep apnea is and the patient overall. Okay. So the sleep study that you spoke about, okay, it's called a polysomnogram, okay, the technical term. It's a study done while the patient is asleep, wearing some monitors, and it looks at various certain factors. Okay, a sleep study can be very complicated and can be done in a sleep laboratory, and it can look at multiple different instruments. But for obstructive sleep apnea, okay, it's actually very simple. Okay, you only need to look at 4 things essentially.
Okay.
You have to look at the flow of air.
Right.
Okay, you have to look at your heart rate. You have to look at the oxygen level, and you have to look at your body position. Okay, so you only need 4 things to look at to make a diagnosis of sleep apnea. So it's made the testing now very simple. For obstructive sleep apnea. We're not looking at other conditions like central sleep apnea, restless leg syndrome. There you need other tools included in the sleep study. Okay, we're just looking at obstructive sleep apnea, which is the common condition, and generally by the history, you almost got your diagnosis. Now you need to confirm and see how severe it is. Okay, so because we only need to monitor these 4 things, okay, the test itself has been now simplified. Okay, it can be done at home. Okay, ideally we prefer for the test to be done at home, in the patient's own environment, in his own bed, where he is comfortable. And I say he, but it could be a she as well, right? And you'd get the best reflection of that patient's normal sleep pattern. Okay. As compared to in hospital, okay, or in a sleep laboratory. Okay. where you're going to be a little bit, the bed may not be comfortable, there's people around you, you're just not going to fall asleep as easily, and it's just uncomfortable. So if a patient requires a sleep study, we try and do a home-based sleep study. A lot of it depends as well on how the medical aid funds it. Okay, some funds prefer it to be done out of hospital, some funds prefer it to be done in hospital. But even if you're in hospital, generally you don't need to do it in a sleep laboratory, just do it in a normal hospital bed. Okay.
With the same monitoring tools that you would at home.
Correct. Yes. Yeah. Okay. So usually a sleep technician, a neurotechnician who deals with sleep, will come to the patient or meet the patient and give them the machine and the monitors, show them how to connect it, how to set it up, how to switch the machine on, how to switch it off. And then the patient uses it for that evening, and then we get the machine the next day and we download that information, and then we analyze it and make decisions based on it. Okay. Yeah. But it's really very simple and become a lot more convenient to do this. Okay. So the idea of doing a sleep study is firstly to confirm your diagnosis. Okay. And it will tell us whether you have sleep apnea, whether you've just got primary snoring, or whether you've got something in between.
This also help you to classify now if there is obstructive sleep apnea, whether it's a mild case or moderate
Exactly,
case.
yeah. So it's monitoring. So as I mentioned earlier, the way we categorize it is by the number of apneic events per hour. That's called your AHI, your apnea hypopnea index. Okay, apnea means absolutely no flow of air. Hypopnea is partial flow of air. So they look at the combination of the two, and the number of times it's happening per hour. So a mild, up to 5 is normal. 5 to 15 is mild sleep apnea. 15 to 30 episodes per hour is moderate sleep apnea, and more than 30 would be regarded as severe sleep apnea. And that helps us to make decisions on how to manage the patients.
And we're going to touch on management.
Sure.
In fact, let's jump into it. So, won't you tell us some of the treatment options that are available for patients suffering with obstructive sleep apnea?
So there's quite a few options. The first thing you look at is just the patient as a whole, in terms of what we would call a term conservative management. Okay, so you look at factors that may contribute to sleep apnea, and try and limit or avoid those factors. Okay, so things like smoking and alcohol. Okay, excessive smoking, alcohol, they affect your they have sedative effects, they have effects on the muscle tone, and they contribute to sleep apnea. Okay, so you would advise those patients for cessation of smoking and alcohol. Avoid drugs that are sedative drugs. Okay,
so your sleeping tablets.
Yes, sleeping tablets, antihistamines, certain antidepressants, these sort of things. Okay, if you need it for medical reasons, then it's different, but you need to be aware and advise the patient accordingly. Okay, look for underactive thyroid, so test their thyroid function. Okay, have to look for hypothyroidism. Okay, and then weight loss. Okay, it's a very important strategy. And as I mentioned earlier, a 10%. You're looking for trying to achieve a 10% drop in your body weight, and you will have significant improvement in sleep apnea and snoring. Even this is just for snoring, not even for sleep apnea. Okay,
just snoring.
For patients that are just got primary snoring, weight loss is an important method of treatment. Okay, so that's your conservative measures. Okay, then you look at other treatments. If you pick up specific problems that you can treat medically, for example, if a especially in like a kid or that's got very big severe hay fever, big swollen turbinates in the nose causing obstruction, or an adult who's got nasal polyps that's
Right.
obstructing the nose. Okay,
These
then
little
you will try.
outgrowths.
Sorry.
These little outgrowths in the
Yes,
nasal
yeah, from the sinuses,
Mm.
within the nasal cavity, they're like these fleshy lumps.
Mm.
Now, these things can cause significant obstruction and contribute to blocked nose of nasal obstruction and contribute to sleep apnea. And it may not be the primary cause, but there are things that you can treat medically.
Right.
Okay, usually with steroid-based medication, usually in the form of steroid nasal sprays
Mm.
to try and shrink the swelling down. Sometimes a short course of oral steroids.
Mm.
So these are the things that we would look at from a medical point of view,
Mm.
or drug
in terms
therapy.
of medication.
Yes, yeah. But that's very limited for sleep apnea.
Right.
Okay, the main treatment regimes, there are three avenues that we look at. Okay, there's something called oral appliances. Okay, these are things that you wear in your mouth, and
Right.
I'll tell you about them. The second one is surgical options, and the third one, most effective one, is what's called CPAP therapy.
Mm.
Right?
Okay.
Okay. So in terms of the first one, oral appliances, okay, these are devices you wear in the mouth. They usually, there are some commercially available ones. They're like a denture type of device, okay, but you're aiming to
It fits
achieve
on the inside of the
okay. And you sleep with it throughout the night.
Okay.
Okay. And the idea is to move move the jaw forward or move the tongue forward,
Okay.
so that when you're sleeping,
Mm.
and these muscles, especially the tongue muscle that loses tone, doesn't fall back and obstruct the airway.
That causes the blockage.
Okay, I forgot to
yeah.
mention that earlier. Okay, that's one of
Mm.
the common things that happens, and that's why sleeping, one of the conservative measures as well, is asking patients to sleep on their side rather than on their back. Because on their back, it's more likely that the tongue is going to fall back and obstruct the airway. But on the side, that's going to be reduced. Okay, so these devices you wear in the mouth are either to pull the jaw and or the tongue forward, and some devices can even pull the soft palate a bit forward. So it creates space. It avoids obstruction at the level of the pharynx.
Doesn't allow that blockage.
The blockage to occur. Okay. So that's one of the devices. It's simple to do. Depending on the type of device, as I said, you get quite cheap commercially available devices that you can buy at a pharmacy. It may work, but then you get more custom-made devices that are made by the dentists or the dental technicians, or prosthodontists, and they're custom-made, and they are a lot more accurate in terms of achieving what you want to achieve. Okay, but then obviously the cost goes up. Right. So these are oral appliances. We spoke about. Next one is surgical. Okay. Now, by and large, surgery itself is depends on the degree of sleep apnea. So in patients who have mild sleep apnea or primary snoring, okay, these patients may be good candidates for surgery. Okay. But if you've got moderate to severe sleep apnea, usually surgery is not going to be your option. Okay. But when we do talk about surgery, we're talking about surgery on any identifiable obstruction.
Okay.
Okay.
Means you found something.
You found something.
It has to come out.
So the most simple one, like the example I gave you, is removing adenoids and tonsils in children that have enlarged adenoids and tonsils, causing obstruction, causing sleep apnea.
Right.
Okay. It's simple. You remove it, problem's cured. Okay. Adults is different. You look at the nose. In the nose, if you've got a severely deviated septum, if you've got nasal polyps, if you've got large turbinates, those can be addressed surgically.
Right.
Some adults may still have adenoids, usually not. But if there's any lesion at the back of the nose, the nasopharynx, you treat that. Then people operate on the palate. The soft palate can be trimmed. Tonsils may be required to be removed in adults. And the back of the tongue base itself can be shrunk down.
Okay.
So these are also surgical options. Okay. Now these the type of patients that would benefit from this in sleep apnea, obstructive sleep apnea, is usually limited. It's usually the patients that are not overweight, the patients that have mild obstructive sleep apnea. So these are good candidates for surgery. Okay. Most patients who have sleep apnea are overweight. and they fall into the moderate or the severe category. And surgery is not usually going to cure this.
Not always an option for them. Yeah.
Unless they got something obvious like huge tonsils, then they got a better chance with surgery. But there we are looking at CPAP therapy. Okay, CPAP, CPAP stands for continuous positive airway pressure. So this is a device that you wear usually over just the nose. Okay, we call it nasal CPAP. And it creates a flow of air. It's connected with a little tube. It's a little mask you wear over the nose, connected to a little tube and to a little machine. Okay, that's usually smaller than the size of a laptop. Okay. And this creates a flow of air. So it's not oxygen. It's just normal air. Okay, but the air is flowing and generated by the machine at a certain pressure.
Right.
And that pressure overcomes the obstruction. Okay, especially when there's a lack of tone and that tube, the airway is collapsing on itself.
Right.
The flow of air under pressure prevents that collapse. It acts like a stent. Okay,
So
but the stent is made of air.
Keeps it.
Yes, it keeps your muscles
Mm.
and your pharyngeal walls. It pushes them apart. It keeps the airway open, and that's how CPAP works. Okay, and you get different types of machines that and they can be set, or it can occur automatically. What we call them auto titrators, where it works out the pressure that's required to overcome the blockage
for each breath
for each,
of that
yes,
patient.
yes, yeah.
Wow.
Okay,
Yeah.
so those are auto titrator CPAP machines. You also get masks, different types of masks that can be, utilized on the patient so that there's comfort. Okay, the main thing with CPAP is that many patients find it uncomfortable to use, uncomfortable to wear and to sleep with. And although it works well, because of the discomfort of wearing something on your face to sleep, they end up not using it. Okay. So there is that category of patients. So although it's something that will work for them, that will treat the condition, they end up not using it. And that's a big problem. It's a big problem. But those that do use it are very successful in controlling and treating the sleep apnea. What you must remember with CPAP therapy, again, like the oral device, is that it needs to be worn daily. Okay, so patients, these things are quite small. They require, patients can travel with them. They take it with them on holidays. They take it with them on business trips. And it actually is quite portable and easy to use.
Okay. We do have a question that's come through on WhatsApp. I think while we're talking about treatment,
Yes,
let's add that in. Listeners asking, is there an approved pill out for sleep apnea or indicated for sleep apnea? I think you mentioned earlier those steroids was...
No. So there's no medication for sleep apnea itself. Okay, but there may be medication for any causative factor. Okay, as I mentioned, simple things like nasal polyps or large turbinates, we would treat that. But that's usually going to be a part of the treatment.
So it's not the whole.
It's not.
The one pill therapy solution.
So unfortunately, the sleep apnea doesn't amend itself to to that sort of simple treatment.
Okay. And coming back to CPAPs, sorry to interlude. How does a person then monitor their progress after starting their treatment? Let's say they're now on a CPAP machine. How do they monitor?
Very good question. Very simple. So what we usually do is what's called the sleep study itself. Right? The sleep study is the diagnostic part of the test. Okay, and that will tell us whether you got sleep apnea.
Okay.
What we do after that, once we made the diagnosis, is do what we call a CPAP titration. So we trial the next night or on another night, we would trial the patient wearing the CPAP machine.
Okay.
And that will give us the results of of how many apneic episodes these patients are having per hour.
Okay.
Obviously, the idea is to bring it from sleep apnea numbers down to normal physiological numbers. Okay. So it's in black and white. It's on the
Okay.
yeah.
Okay.
So that's easy to test.
And what can happen now if someone who needs a CPAP machine unfortunately wants to stop it because maybe it's noisy, uncomfortable? What happens to that particular patient?
Yeah, so those sort of patients, and unfortunately, it is a significant proportion of patients who use CPAP is that they end up not using CPAP because of the discomfort. So those patients, you got to look at then the other options, the oral appliances, okay,
Right.
and surgical options.
Mm.
And in that sort of patient as well, even though they may fall into the moderate or severe category of sleep apnea, if they're not using and not prepared to use the CPAP machine, okay, that means they're getting zero treatment and zero results.
That's right.
Okay. If surgery is an option but may not give the perfect results, they are getting some degree of treatment and some degree of improvement and relief. Okay. So in that sort of patient, we may still look at surgical options.
So it's not particularly option A, but we may have some other smaller things that can help.
Yes. Yeah.
Okay. But all in all, we've got to now just find the perfect fit for each particular patient.
Exactly. That's exactly.
Based on what the cause is and how bad it is.
Yes.
Well, unfortunately, that does bring us to the end of our deep dive into the topic of sleep apnea. I mean, there's so much more to explore and talk about, but I think we did a good job in covering how it can be detected, the many ways it can be managed, and most importantly, that with the right help, this condition is treatable and life can vastly improve. Before we wrap up, a quick recap for anyone that may have just tuned in. Can you give us some takeaway points from tonight's show on the topic?
Yeah, the first thing, the most important thing is don't ignore snoring. Okay, snoring may not just be snoring; it may be sleep apnea, and be aware of that. And if you suspect that it may be, then have it assessed. And the main reason for that is because of the consequences of not having it treated. Okay, which can be cardiac, can be diabetes, hypertension, strokes.
Right.
Okay, so my take-home message is, if you are a significant snorer, have it assessed, have sleep apnea diagnosed if it's there, and have it managed in order to prevent significant health risks at a later stage.
Dr. Thandar, thank you so much for walking us through this topic tonight. You've really helped demystify a condition that so many live with in silence. And to our listeners, we appreciate you listening in. If you missed any part of this, remember you can catch the full episode on the Al-Ansar YouTube channel. And that's it for tonight's edition of Medical Files. Thank you so much for joining us, spending your time here in studios with us this evening. We appreciate
it. It's been a pleasure.
it.
Appreciate the invitation.
That's it for tonight's edition of Medical Files. Remember, health begins with awareness. And if you suspect apnea in yourself or a loved one, visit your ENT surgeon and try and get help. So catch us again the same time next week with another episode of the Medical Files brought to you by the Islamic Medical Association of South Africa. I'm Dr. Zakaria Ahmed Ismail, and until next time, be kind and stay healthy.
كي أتفاخر وظننت أنا أني بذلك حزت غنى فوجدت أني خاسر.
Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical